Inequalities have always existed in cancer care, but have too often been ignored. Over 375,000 people across the UK every year are facing a cancer diagnosis, and half of us will face the prospect of a cancer diagnosis in our lifetime. Yet experiences of care can differ widely. Gilead Sciences are working to reduce this health inequality in cancer to give patients the best possible outcome, no matter what their circumstances.
Stuart has blood cancer, chronic myeloid leukemia. It's incurable, but daily medication keeps it under control. When diagnosed aged just 29, Stuart quickly found being gay and non-binary made finding help and information much more difficult.
One of the things that's difficult is knowing who to take with you to appointments, and especially when you're queer, there's sometimes that fear of, can I take this partner into the appointment? Will I be respected as such? And the other thing is also, by extension, wanting to talk about your personal life, your intimate life, sex life, etc., and impacts. And especially in those points, my clinicians just weren't really comfortable with those conversations or had the knowledge.
When it comes to blood cancer care, it's not a level playing field. Many minority groups face poorer outcomes and report poorer experiences of cancer services. Where you live, the colour of your skin, your sexual orientation and gender can all impact the care you receive. And NHS research shows it costs lives. In one type of blood cancer, for those living in the most deprived areas, just over 55% will be alive after 5 years, versus over 63% in more affluent areas. That's almost an 8% difference.
I think we're seeing the gap widen across the country. We're starting to see that not everyone has the same access to the latest treatments, the latest, the high quality patient information. But that shouldn't happen. It shouldn't depend on where you live. Some people are worried that they'll get discriminated against if they come into healthcare services, and other people aren't aware that those services are there and available to them, or the information about those services isn't necessarily accessible enough due to all sorts of protected characteristics. It might be literacy, it might be not having English as your first language, it could be your age, it could be your gender. Any number of reasons can make healthcare services less accessible to some people in our society.
Stuart set up a national charity to help those in the LGBTIQ+ community living with cancer. Live Through This offers online information for patients, educates healthcare workers and creates bespoke campaigns to better protect the community.
We've worked with Macmillan to create pages for the website, and I've just managed to get them to confirm they'll put it into press. So it's really going to be making these differences so people can feel seen in these spaces and they can find information that is directly for them.
Lymphoma is the most common type of blood cancer. Dallas worked as a nurse in the NHS for 26 years before joining the charity sector. Part of her charity's work is to help healthcare professionals be more inclusive.
It's about asking the right questions as well. So, what pronouns would you prefer me to use today? How would you like me to address you during our session? Who are those people that are close to you? So steering away from, are you married? Do you have children? And those sorts of questions, I think, and allowing that conversation to organically grow as the trust is formed.
Dallas and Stuart's charities are supported by pharmaceutical companies Gilead and Kite. They work in partnership with the NHS, government, academia, industry and charities.
As well as supporting the national charities, we also really need to support grassroots charities. I think they've got such expertise and knowledge from the patients and communities that they serve. So it's really critical that we give them the space, the resources to really help them get their messages across, to give them access to different platforms, to make sure that their voices are heard.
Stuart was originally a tattoo artist, but the cancer diagnosis drew Stuart to another way of life. So you seem to be enjoying life, you're very happy?
Yeah, I think it is lemons into lemonade. It's this aspect of, I think the other way I describe it really actually is, I tried to sort of move away from cancer for quite a while and sort of just have this sort of normal life and hold on to the previous life I had. And then I realised it's incurable. It's not going anywhere, so I have to lean in and I have to make a difference and I have to try and figure out a way that I can live with this. And that's how the charity came about.